Through fertilizers or pesticides that we are using in growing our food products or food ingredients before they come to our plate. So these questions are asked by different communities in different form. But not everybody necessarily knows that unsafe food brings a high burden of disease. Approximately 2.2 million people annually die from diarrheal diseases or other waterborne diseases, and many of those who suffer are children. This is a very specifically important element because children cannot protect from themselves, and it is adults mainly who are responsible to make sure that children don't get infected, don't get diarrhea. But even worse, it's not just children, but it's the poorest of the community as usual that are affected by this challenge. And those marginalized people who do not have access to food, let alone safe food, of course will be most affected. So this is a challenge in terms of alleviating poverty, in terms of ensuring sustainable development of the communities, and we are all very concerned with that. It is also important to remember that we are talking in many ways about food. We are not just talking about food safety generally, we are talking about healthy food, health promoting food. We are talking about food that contains a lot of sugar, a lot of salt. So we are always saying that we should take care so that non-communicable diseases don't get proliferated and the epidemic of non-communicable diseases doesn't grow further. For that, of course, we need to look at the highly processed food, which is becoming more and more popular. It is more and more convenient for many who use it, and especially because it is also cheap, it is available easily, it saves time. But then, of course, all these stages of processing this food not only makes it less healthy, but also brings safety elements very much into focus, because there might be a lot of compromised processes starting from the growing these ingredients, storing them, distributing them, and then processing them, where mistakes can happen. And we also must remember that there is a big issue of antimicrobial resistance in foodborne pathogens, which is growing because of all the other challenges that we are facing in terms of handling the food supply, evaluating impact of new technologies, which is essential because of all the animal food production and animal husbandry role in bringing those pathogens in our food. So what is clearly happening in our thinking is that we should not be just asking questions whether a final product is of good quality. It's like the medicine production. In medicine production, we are always talking about good manufacturing practice, where you actually control quality at every stage of processing or production of the medicine. Similar approach must be incorporated into food processing and food production so that we are sure that at every stage, precautionary measures, preventive measures, and compliance to the established set standards have been taken care of, and that our final product is therefore safe from all those sides. Now, what that requires is clearly that we need to establish and promote collaboration between various sectors that are involved in this chain, and also that it cannot be just resolved at the national level. We need to promote international collaboration because of the globalization of the food. Food is moving, it has a lot of economic implications also. So there are many processes, starting from the growing the vegetable in the field to the highly sophisticated regulatory mechanisms and standard setting, which need to be endorsed also. In terms of burden of foodborne diseases in India, we do not have really good and accurate data. The surveillance data from National Surveillance System for the years 2011-2014 shows that the outbreaks, foodborne outbreaks, together with diarrheal diseases, constituted nearly half of all reported outbreaks during this period. So it is a huge burden, of course. But what we certainly know is that the diarrheal diseases are a third leading cause of childhood mortality, and that is responsible for 13% of all deaths in children under 5.
That is, of course, a significant number which requires a lot of attention. Having said that, we need to remember that simple interventions such as washing hands, and this year we have been, or last year, we have been putting a lot of attention on hand washing procedure as a means also to prevent nearly half all possible diarrheal diseases that we are facing in this country, but in other countries as well. We need to remember that India is also specific in terms of its context from the point of view of tropical livestock density in India. It's very high. Therefore, we are having higher risk of novel diseases between animals and people. So these risks need to be prevented. For that, we need to strengthen our research, policy-making capacity, but also educational capacity. And we need to do more studies on zoonotic diseases in India, because we are seeing that there are many issues we still have unanswered, many questions that require more thorough research. For that, we also need to concentrate on strengthening surveillance system, not just in human disease terms, but also in animal sectors, because there is a strong interlinkage and interrelation between the human health and animal health as well. I want to say a word about pesticides and fertilizers that have been used increasingly over the last 50 years, and their use has increased or has multiplied by 170 times. So we're facing much higher risks from that point of view. And those pesticides and those unhealthy elements, they are dispersed in the environment, and then of course they enter into the food chain. There are many of those that are known, that are even prohibited in agriculture, but nevertheless they are still used in India because they are cheap and they are economically viable still. A lot of food is being produced in the streets in India. Millions of men and women who cannot afford to have better access to food, they use the street food. And it's something which is, again, putting many of them at risk because of climate, because of heat, because of improper conditions maybe for storage of this food. We have been working collaboratively with the National Association of Street Vendors in India and National Skills Development Corporation, where we have been trying to introduce teaching and educating those street vendors. We hope this initiative will be sustained and will contribute to make street food more safe and more nutritious. I want to mention the importance of the licensing procedures and inspection procedures and hold that capacity which is required, and training, more training of this enforcement capacity is required also. Malnutrition is of course a significant problem in India, and it is still connected also with unsafe food because of diarrhea and many other related events. So without combating this element of malnutrition, we will not see sustainable development. That's why, in fact, these elements are very clearly included in the currently drafted post-2015 Sustainable Development Goal agenda. It is important for India to also take into consideration that there are government programs which reach out nearly 200 million people with the distribution of the food system, free food system, and unless there is a high attention given to the safety elements in this important program, then the program will not achieve its impact. Because it can actually bring more harm than help. I would like to mention that Swachh Bharat mission of the Prime Minister of India that is very much looking into sanitary and hygiene and cleanliness at large clearly will also contribute to safer food. So it is very interlinked with this important initiative. But also it is very linked with the initiative of Make in India campaign of the government, because India has huge potential to materialize and realize its agricultural potential by increasing domestic standards for food safety and compliance to reduce risk, so that Indian manufactured products can more easily enter into global market also. So that has a lot of significance for that particular initiative as well. India now has, since 2006, Food Safety and Standards Authority of India that is comprehensively looking at the standards and the regulation of production, storage, distribution, sale, and import of food. There are many laws and regulations that have come, which are very welcome. I believe that we still need to pay attention on enforcement element, especially not only at the national level, but also at the state level. And there is a varied situation in different states. With all this, of course, multi-sectoral collaboration has to be emphasized and re-emphasized again. I want also to mention important strategy of educating consumers, which is not just training people who handle food, but also educating children on how to prevent and protect themselves from unsafe food. That will have a major impact also in India, it is what we believe. Growing safer fruits and vegetables is very relevant to the agriculture sector and all people who are involved in that work. WHO has been over 5 decades now involved in the food safety related work. And we have proposed 5 keys to safer foods to explain the basic principle, what each individual actually should know in order to prevent foodborne diseases. We hope that at the end of this consultation, you will remember those 5 keys of WHO. But WHO is not the only agency within the United Nations that is looking at the food and food safety related issues. Of course, food security is very much interlinked with food safety and health as well. So we are working with the Food and Agriculture Organization of the United Nations, and we also work with the World Organization for Animal Health. The international health regulations that many of you are very well aware of, which is a treaty that all members of the WHO have committed and signed for, which is legally binding treaty, is very much also looking at preventing any outbreaks of international significance, and many of them can be caused by the unsafe food chain and unsafe food. So public health security is very much in the center of international health regulations from the food safety prospects of all. Again, how do we bring together all the stakeholders that should play critical role in terms of effective collaboration to prevent this problem from growing out of hand? I think we have no choice. We have to think of more creative mechanisms. There are many mechanisms that have worked in different occasions in India and elsewhere, but we need to discuss how to make it even better. Finally, today, WHO will be also giving and recognizing some outstanding individuals and institutions who have done significant contribution to the improvement of public health in India. And those public health champions will be given awards today, and I would like to congratulate all of those who have applied for this award, but also more so those who have been selected. So we have used this WHO World Health Day to give these awards today. We all want to see that our food is safe, nutritious, and health promoting. And on this World Health Day, I call all of you for greater collaboration to make this happen. Thank you all very much for being here with us.